Okay, welcome everybody. We're so delighted to have so many people tuning in to this live stream today and this discussion with my friend and colleague, Vincent Lin, who has just been a force during this difficult time, leading a team as the Associate Director for Health Policy and Advocacy at Partners in Health. I'm Joia Mukherjee. I'm the Senior Clinical and Academic Advisor at PIH. I'm just so delighted to be spending more time with so many of you, our supporters. Um, Partners in Health is uniquely resilient during this time. So many of our peer organizations are single issue or single funding stream focused and have really not weathered this difficult political storm. And because of all of you, we have been able to continue our care, to continue to move forward on the promise of making a preferential option for the poor in healthcare, and really fighting for justice and dignity for our patients and for vulnerable people throughout the world. I want to give special thanks to the Leadership Giving Society for hosting this webinar. To remind people, the Leadership Giving Society is donors who are committed to PIH through an annual contribution of $1,000 or more. They really sustain our work in incredible ways. So we are just so grateful to any of you who have have tuned in, and for you making it possible to for us to reach so many people today. We heard that nearly 1,000 people had signed up for this webinar. So I just want to highlight that Partners in Health has always been an organization that has sought change. And the reason we've always sought change is that around the world, poverty, inequality, marginalization, racism, these are things that determine health outcomes far more than medical care. We know that people need medical care, but that medical care is not easily accessed for people living in impoverished situations. And so the movement for global health equity was really led by people living with conditions, particularly those living with HIV and AIDS around the world, who stood side by side from the global north to the global south and said, no, we all deserve access to these medicines. And what we saw was this great transformation that occurred when people around the world stood together and demanded health as a basic human right. And that was in the late 90s and early 2000s. And it was a movement that really transformed our ability to provide all kinds of care, not just HIV care, care for tuberculosis, care for pregnant women, cancer care, because once we fought for the right to HIV treatment, we were truly fighting and opened the door to fight for global health. So many of us have been involved from holding up signs, from protesting at Congress, to supporting the work of Partners in Health through generous donations, through supporting us through your time. Many young people, particularly, but young and old alike, have been with us on Capitol Hill when we are demanding improved policies from our representation or our representative officials. And in that frame, I really want to introduce Vincent, who's going to be, sharing with us the many challenges and most importantly, the accomplishments of our policy and advocacy work in this difficult time. So Vincent's been with us for more than a decade now. I know that because he helped me get my textbook Introduction to Global Health Delivery over the line when he was still supporting Paul Farmer as an undergraduate student. And now he is leading a lot of these efforts on the Hill. and really understands how the sausage is made in terms of health policy and which of the health policy pressure points are most important for us at PIH to assure care for our patients. So I'm going to start out by asking Vincent to give us an overview on what's really happening in Washington. We hear that USAID has been effectively decommissioned. We hear that global health expenditures are not going out the door. So we'd love to hear from you with so many of these stories coming to our attention. How would you have us understand these issues that are affecting global health coming from the DC lens?
Thanks so much, Joia, and great to be with you always. I think, we could start actually with some of the major programs that Partners in Health has actually been partially responsible for creating, which really reduced the incidence and mortality from HIV, TB, and malaria over the last 2 decades since their initiation. And so just to take it from the highest level, the US government provides over 12 billion a year in global health program funding. That comes through many different mechanisms. Many folks have heard about the US Agency for International Development funding for example, tuberculosis and malaria, maternal and child health programs. We've also been talking a lot about the President's Emergency Plan for AIDS Relief, which is implemented by USAID and also the Centers for Disease Control. And there's also multilateral mechanisms, which are often pooled funding from many countries. So the US contributes to the Global Fund to fight AIDS, TB, and malaria, which Joia and others were critical in the creation of, advocating for the creation of, as well as UN agencies like UNICEF, the World Health Organization, for example, and Gavi, which funds vaccine supply chains around the world. And so the US, for several decades now, has really been the leading donor to global health efforts across all of these streams. And Congress, writes the budgets for all of these entities. They lay out, for example, about 400 million a year in US funding goes to tuberculosis programs across 25 countries. Back in the early 2000s, Paul Farmer and Partners in Health's initial programs in Haiti were brought to the White House as actually a case study to show President Bush's administration how PEPFAR could be implemented and scaled, especially in rural areas with community health workers. And for those of you who haven't seen Bending the Arc, I think it's a great documentary that really follows the evolution and growth of these different resource streams that are really important to the global supply chain for HIV and TB medicines and malaria commodities, tests. We're talking testing kits, treatments, and also a lot of the people that run and operate those programs across many countries where Partners in Health works. And so we've seen the full effects of disruptions across USAID and PEPFAR and the Global Fund in particular this year. And earlier this year, we saw a freeze on all payments for global health programs. We saw thousands of programs in foreign assistance terminated overnight in March. And then we also saw the administration pursue what's called a rescissions package, which aimed to cancel out funding that Congress had already allocated for global health and development programs for fiscal year 2025. And so, I'm extremely grateful, and I want to take a moment just to thank all the friends and colleagues on the call who I know have been emailing their members of Congress, calling them, sometimes doing meetings in person, either in the district or in DC, to raise awareness about what's happening and to say that, there are constituents and voters who do support the utilization of these funds for these reasons. And it, in fact, would like to see additional funding for entities like the Global Fund, because we are still very far from, defeating HIV, TB, and malaria around the world. There are a lot of people still going without care. And so, earlier this year in the first rescissions package, due to Republicans in Congress standing up with Democrats to say, PEPFAR, the President's Emergency Plan for AIDS Relief, is a really critical bipartisan program. We don't want to see that funding cut. Even though the White House requested a 400 million cut to PEPFAR, that was actually rejected by Congress.
Mhm.
However, other development assistance, and we know we talk at Partners in Health a lot about the five S's of healthcare, staff, stuff, space, systems, and social support. A lot of development assistance that address the pillar of social support around food and humanitarian aid, water and sanitation, basic education, those were all cut dramatically in that first rescissions package, and more recently in a second rescissions package, which for those of you following very closely the news, is also termed a pocket rescissions package because it is a new way for the administration to sort of go around Congress and utilize an area of the Impoundment Control Act to unilaterally cancel out funds. And so that is in the courts. It will continue to be litigated, and I think a really foundational case on how impoundment in the United States is addressed between all three branches of government. So the US at this time, we have two really key emergencies that we're dealing with that are impacting our colleagues and our patients across all of our sites, actually. The first is around PEPFAR funding. So Congress in fiscal year 2025 put up full funding for PEPFAR. That's about 6 billion between what are called bilateral country to country mechanisms across 55 countries and also multilateral funding through the Global Fund. And the Office of Management and Budget is currently withholding about half of that amount, which is unprecedented, and we've never seen that happen before. PEPFAR, which is run out of the State Department and implemented by USAID and CDC, is now cutting significantly programs around the world. And in Haiti, for example, we're seeing huge cuts, 30 to 50% cuts in programs that to date have actually not been impacted by financing changes, although there have been changes to what can be done with the funding available. And so that's really concerning. I think we're all very scared about the impacts of this across all countries. In Haiti, Partners in Health takes care of tens of thousands of patients, and we are worried that patients across Haiti will lose access to the staff support and clinical staff. They'll have their treatment interrupted, and there's no way to maintain programming across the country if you're looking at a 30 to 50% cut overnight. And so what we're doing as a team and with grassroots networks like the PIH Engage teams and the TB fighters is contacting our members of Congress to let them know about what's going on. Congress appropriated full funding for this program, but that funding is not being utilized. It's being held, and in theory, the White House could hold on to that funding for 5 years and not spend it. Um, I think so I highly encourage you to try to reach out to your members of Congress, whether that's through calls or emails. We have a email tool that I think my colleagues can put in the chat here, where you can very quickly get in touch with your members of Congress. And the second emergency we're dealing with across all countries is that the US is also withholding funds from the biggest multilateral entity that deals with HIV, tuberculosis, and malaria, which is called the Global Fund. The Global Fund should receive another $1.3 billion from the US, which Congress has already appropriated in fiscal years 2024 and 2025, except the US government, specifically OMB and the State Department, have not released those funds. And that means that the Global Fund programs across over 100 countries are cutting back on their malaria, TB, and HIV work. This really has a huge impact on countries like Liberia with a high burden of malaria, as the Global Fund and PEPFAR together do a lot of the global supply chain on commodities, and fund a lot of the frontline health workers. Our colleagues in Lesotho have talked about how with PEPFAR going down, HIV and TB patients have to travel to there was one patient who had to travel to 9 different clinics just to get a diagnosis for TB. And that is a direct result of some of these cuts to frontline health workers through PEPFAR. And we know that, we're at very heavy risk for similar cuts across the Global Fund. And
Yeah.
my colleague, Kat, wrote some great pieces on the PH website, which you can read, that go into much more depth about how these changes have occurred, the sort of timeline of changes, and also what can be done and how these problems can be resolved, because they're absolutely solvable problems. And, it's also really important for members of Congress to hear from voters and constituents that people are paying attention to this, that
Yeah.
when a program collapses or is, cut 30 to 50%, that there are people watching, paying attention, and, people in the US do care about these programs. And so they have to hear that from
Yeah.
all of us.
And thank you for saying that, Vincent. I think that's just a good segue to just hear a little bit. Of course, what we love about Partners in Health supporters and this big family of people calling in and joining us is that you do care about individual patients. And, just one story we heard from Haiti recently is one of our oldest patients with HIV, Asafi Theodore, is 72 years old, and she has been on HIV therapy consistently, never missing a day, thanks to her community health worker, for 17 years. In that 17 years, of course, she's seen her children thrive, her grandchildren thrive. Um, but she is really part of our network now as a community health worker herself. So not only have we been able to, with this AIDS movement and this money from Global Fund and PEPFAR, as Vincent was talking about, save her life, she has become, an important member of the community of people living with HIV who can help others. And she recently developed tuberculosis, which is not uncommon for people living in, difficult situations in Haiti. But as this money shrinks, she is the kind of person that could lose her access. We believe we're okay for this year, but according to our director of infectious disease, the Haitian doctor Alan Cassius, beyond the 2025-26 fiscal year, it's unclear. If people like Asafi miss their medicines for a week, a month, that is deadly. That generates resistance. And this is somebody who is not only alive because of these medicines, but an active part of a network that provides care. So it's for people like Asafi, who are not only our patients, but our colleagues, that we have to continue this fight. And as Vincent has said, what we've seen, is that people do care. Americans do care about people like Asafi. And, we also know that this money has helped us to manage shocks, and Peru is a great example of that. On the USAID side, they've received money from the department's Bureau of Population, Refugees, and Migration, and have been able to reach thousands of Venezuelan migrants in Peru. And we know that the chaos in Venezuela is likely to continue. And Peru is one of the places that has accepted migrants and refugees. And they're able to provide HIV screening, tuberculosis screening, and care for these refugees. So between climatic shocks and geopolitical shocks, our teams have been able to really support people. So there's two, big pieces that we worry about here, which are the supply chain, as Vincent has talked about, the drugs for HIV, TB, and malaria, but also the impact we can have on civil society, hiring community health workers, doing things like teen clubs. You know, two of our young women that have HIV in Malawi are able to continue, Bernadette and Yvonne are able to continue their education because of the social supports we can provide under some of these grants. And that allows them to spread the message of, you know, HIV testing, HIV prevention, but also, you know, give them hope in the future. And so this support really has human faces in countries all over the world, both on the, you know, getting people medicine, but also giving them jobs, a basic dignity, and the overall social support. So we're just, you know, we know you want to hear about those human stories, and there's so many of them. And I also know, Vincent, that you will be doing a Reddit AMA next week to go even further in the weeds for people who really want to understand this more. And perhaps you know, you've already shared with us some of the tools that people can use to contact their representatives, but maybe you can talk a little bit more about the Reddit AMA work that you're going to be, or presentation you'll be giving, and any additional kind of tools and advice you can give to our audience before we move to some questions.
Thanks, Troy. Yeah, so next week we're doing an AMA, Ask Me Anything on Reddit, where folks, you can submit additional questions about you know, what's going on with global health funding, or what Partners in Health is doing in the response. Um, and yeah, we'll be happy to take those questions and can take them in depth and you know, as Paul taught us, include all the citations and footnotes to give you all the information, all the weeds, all the details that you might want.
Yeah, and just to say, you know, the weeds for us have helped all of us really to understand the why. So, you know, for those of you who want to become policy wonks, I mean, it is one of the ways that you can help PIH, right? Is by, you know, becoming expert in this. And everybody has their own path to helping, but I don't think, Vincent, you started this wanting to be as in the weeds, but you love it, and becomes apparent when you talk about it. So we really appreciate anybody who wants to take that deeper dive. We have some pre-submitted questions, and also we are happy to take questions in the chat, and you can do that chat on YouTube. We've been able to, through the miracle of science, put those through. So I'm gonna go through a couple of questions. First one is really for you, Vincent. How does the government shutdown affect our advocacy efforts? So we have, you know, all of this issue going on, and then we also have a government shutdown. So what do you think about that?
Yeah, so uh, it's it's been a really interesting experience this time. I mean, it's been a while since we've had a government shutdown. I think just reflecting on your earlier piece about how I ended up, you know, way in the weeds. When I first did a meeting with my member of Congress, I never realized just how easy it was to actually have that conversation, talk to a real person who represents me and, you know, my community in Congress about these issues that, you know, they're hearing very little about from the American public. And I think that door was far more open than I thought it was. You know, calls in Congress are listened to every day. You can write snail mail. They open that twice a day, actually, through USPS deliveries in the offices. They read local newspapers. They take meetings every day. Sometimes they take 10 meetings a day with, you know, local constituents and people who live in the district. And so if you're willing and you're able and you have time to um, talk to your member of Congress, often, you know, that door is much more open than I think people realize. And I think people are really surprised when they maybe even visit DC for the first time that you can, you know, you can walk in and talk to your member and their team about whatever it is that you think about. And ultimately, that's how public budgets are formed. And I think one thing that's been really exciting this year, um, and even now during the shutdown, is we have more and more people that are talking to Congress for the first time about why global health matters to them. Lots of young people who are mobilizing to get to DC. Earlier this year, we had a Hill Day, a day on Capitol Hill, where volunteers came in and spoke to their members of Congress about tuberculosis. And even in this time, we had a record number of signers from both parties on letters that said we should increase our global TB funding from 400 million through these bilateral mechanisms to a billion every year. And that's a function of, everyday voters,
Yeah.
folks who aren't public health experts or physicians or, clinicians in any way coming and saying, hey, this is something that I care about. I would like to see you take more of a stance, more leadership on this. And actually, in a sort of positive way, Congress has really responded to those calls, right? In the global health realm in particular, um, we saw that the House Republican bill for the next year's funding actually keeps most of the funding flat and actually reverses some of the cuts that were made in the rescissions. Um, we are still yet to see the Senate bill come out, which is tied into the shutdown issue. But I think, we're hopeful that the Senate with a, 60 vote requirement will have a pretty bipartisan deal on spending for global health that's pretty similar to past years. And so I think what's really critical, especially long run, is making sure that Congress, which holds the power of the purse, at least historically, continues to put up the funding for these programs. And actually, in the shutdown, we've had quite a lot of meetings with Congress. Just had a
Thank you.
few yesterday.
Yeah.
And people are getting through. Actually, a lot of the staff aren't really working on other things at this time. And so they're picking up the phones more. They're spending an
They're
hour on the
bored.
calls. Yeah, I heard someone say yesterday, oh, it's great to have a meeting. It's been like several weeks. So I think during the shutdown, it's a great opportunity actually to reach out to your members and have those conversations.
Yeah. Thanks so much, Vincent. I think, the good news here that we're hearing from Vincent and that we always feel at PIH is that advocacy works, right? And even in difficult times, global health has been very bipartisan. And even as we see the government increasingly polarized, which everyone talks about, that there is still, a sentiment that we should, do better for people. So there's always some good news in here. There's a live question that was submitted, which is, and this is, I think, a great one for you to take on, Vincent. When you talk about the administration withholding funds for PEPFAR and the Global Fund, that's not legal, right? Um, and how is this playing out in court? Or what is the strategy to hold government accountable for some of these things that we think are actually illegal? As you talked about, the power of the purse is supposed to be in Congress. Much of this money has already been appropriated by Congress. So maybe you can explain like that's not legal, right? I love that.
It's a great question. And I think it's one of the TV fighters who submitted it. And shout out to the TV fighters who have just been
Celeste. Yay, TV fighters.
amazing in
Celeste.
advocating. And thanks to John, of course, for rallying the community around the cause of tuberculosis as an injustice and everything being TB. I think it's a great question. It's a bit complex. So the appropriations law that allocates funding or appropriates funding actually really differs by each of the line items. So some funds, for example, like USAID, are given 1 or 2 year expenditure and expiry dates. There are other funds that have no year expiry, which means they don't expire. And there are other funds like PEPFAR and the Global Fund, which are given 5 year windows to be obligated or put forward to different entities for spending. And the legal cases actually all turn on the clauses that Congress writes into the appropriations law for each of those line items. And so when we think about withholding, uh, we have to be specific to how the appropriations laws are written for each of the line items. So that's definitely played out in the ongoing case around USAID funding, impoundment. This is the sort of Global Health Council and AVAC combined court case that has gone up to the Supreme Court several times, is now pending in the appeals court. And then there's also several laws that are related to impoundment of funds, the Impoundment Control Act of 1974, as well as the Administrative Procedure Act. And the Supreme Court recently ruled that private plaintiffs weren't able to bring forth cases under the Impoundment Control Act, but the appeals court upheld that the Administrative Procedure Act is something that private plaintiffs can have standing to sue on. There's the involvement of the Government Accountability Office and the Comptroller General. So I think it's still very much early in the overall timeline for these impoundment lawsuits that are playing out across many issues, many agencies, in addition to global health. But I think that's the one case to follow pretty closely as it relates to global health spending is the Global Health Council case and perhaps future cases as well over the next few years if withholding continues. Uh, and actually members of Congress are working to change the Impoundment Control Act itself to put forward larger regulations and penalties on how the White House has or doesn't have control over spending.
Yeah, and maybe, I think understanding that, and thanks for that great question, Celeste. Vincent, maybe you can provide some examples of how our actions have been effective in protecting global health, because we've had some big wins, and you mentioned them
Yeah,
slightly, but maybe you could highlight that a little bit more.
sure. Yeah, absolutely. Since early this year and even going back to previous years, there have been tens of thousands of calls to Congress from people across every state in this country, from our network, almost every district in the country as well, talking about the importance of funding for PEPFAR and the Global Fund and USAID programs in global health. And yeah, I definitely want to thank and celebrate all the work that's been done to end the freeze on the payment system that happened earlier this year, um, to make sure that PEPFAR funding was pulled out of the rescissions package, which was a huge win,
Huge one.
and also a deterrent for future rescissions packages, right? Every time Congress takes an action on one thing, it's not just in the moment, but for the next, it sets the sort of baseline for the next 5, 10 years. And then more recently, a lot of folks have been calling Congress to say, make sure that the USAID funds for global health through bilateral systems get out the door before they expire on September 30th. And that did happen earlier, this just about half a month ago. So there was about 4 billion in funding that did make it out of the door before the expiry date. And that's absolutely credit to a big push from civil society, from advocates, and from Congress to say, look, we appropriated these funds. We don't want to see them expire. This is a different issue than withholding for PEPFAR and the Global Fund, but we're really grateful and thankful that those monies are going to flow and actually reach sites in the coming months and over the next year or so. And we're going to have actually that same fight ahead of September 2026 as well with the FY25 funds. So absolutely stay tuned as we try to continue to make the case for making sure that the money that Congress appropriated gets spent properly.
Yeah, and every little drop of water, every call, every email is something that can tip the scales toward justice. And I think, all of you can be part of that. That is not a heavy lift, if we all do our bit. And so thank you so much, of course, Vincent, for always doing that. I just want to take on a question that I'll answer myself is, how we can assure different donor efforts are coordinated to make a difference, and particularly with the ministry. And I think this is the real secret of PIH. We are two people representing a staff of nearly 17,000, 98% of whom are local national folks. So community health workers, drivers, cooks, cleaners, doctors, nurses. Our strategy is 100% to support the public provision of healthcare. So we are constantly working with governments. And so we are at the table all the time with our government colleagues, whether that table be in a capital city or at the local district office. And so we are going over with them, like, what are the things you need? What are the biggest gaps? And we're hearing over and over again that it really is commodities and some salary support. When we can, we try to fill those gaps. When we can't, we're trying to find other partners, other donors, even that can go directly to governments. It is a really tough time, but to us, the most important thing right now on the ground level is to have no money wasted. And the best way to do that is through coordination locally, at the hospital, at the clinic, in the communities with governments. And so, I think one of the things I always feel most proud about our work at Partners in Health is how closely we coordinate with the government so there's not a duplication of resources and so that the real critical gaps can be filled. Things as simple as fuel for government cars to go and pick up samples, we will fill that gap. So these are kind of things that we're seeing that we're trying to coordinate with governments. We're trying to, when we can, step in to support their systems of care, of logistics, and I think we feel that that can really continue. This is a good question, I think, for you, Vincent, and I can certainly hop in because the question that is coming live from YouTube, thank you so much. For people who always are debating with us, like, why should the US help other countries rather than do work in our own country? How do you respond to that in your advocacy work? Because that comes up all the time.
There are such a range of motivations for funding global health programs. I think actually first and foremost, at least when we have conversations with members of Congress and policymakers, it is a humanitarian lens that carries the day. And that, as we understand it, is why PEPFAR was created on a bipartisan basis, but especially with Republican leadership. I think that still carries huge weight today, and maybe is underestimated in how powerful that is. A lot of members of Congress speak often about how their faith is tied to their public service. And I think that is actually very much related to why we see continued funding for these programs by Congress, even at continued flat levels, right? Republicans in Congress this year actually rejected Trump's budget request to reduce PEPFAR spending, reduce the Global Fund, cut TB programs in half, really dramatically reduce funding for malaria and maternal and child health. And I think that is tied to the humanitarian side of things and the sort of faith-based motivations, maybe more than anything else. So certainly members of Congress also think about, TB outbreaks in Kansas. They hear about from their constituents measles outbreaks that are happening. They are folks from Nebraska, for example, remember like it was yesterday when Ebola was, spreading locally. And I think there's always worry, fear, and concern, especially after COVID, that, pandemics have such a heavy toll on communities, on people's lives, on families. I mean, how many people we lost in the US during COVID, and then, of course, on the economy as a whole. So I think they feel like, from a standpoint of protecting their constituents, that it is very important to invest in fighting against diseases globally, which, absolutely no borders, in any sense of the word. And then I think the fourth motivation that also really carries weight is that, members of Congress are supposed to represent the interests of their voters. And sometimes members of Congress themselves maybe hold a position and their voters hold a different position. and they will listen to what their voters want and vote, take positions in that way. And
Mhm.
so I think in addition to maybe the individual motivations of members of Congress or policymakers, if they're hearing from enough people in their district that they care about something, then they'll often vote in that way, even if it's different from their own personal position.
Yeah, and I just want to add briefly to that, and then I'll, shoot you another question because I think people are hungry to know ways that they can help from what the live questions are coming in. But one thing I always say to people is, it isn't either or. We are the wealthiest country in the world, and if we want our society to be defined by humanity and dignity, the same fight is true for saving Medicaid. The same fight is true, for building more housing, low cost housing. And it's not that we have to silo global health from, the healthcare of Americans. Like we can be a society that values both. I mean, some of the most powerful, changes we've seen in the US, like during COVID, came from our work globally, to link contact tracing with equity focused social agendas. And so, I think, what I always tell people is, we often work with people who advocate on the domestic side. These issues about human dignity, justice, the right to health are cross-cutting in any society. And so I think trying to say what does a human-centered compassionate budget look like for a country that has to involve uh, who we are as a global community and who we are to our most vulnerable citizens as well. Vincent, I think a couple of people have asked, what can people do locally? Are there advocacy actions people can take outside of DC? Are there specific geographies that need help? What can we do in our own states for Partners in Health, for this movement, to advocate, to volunteer, etc.
Great question. Yeah. And just to follow up on the last piece, our national federal budget on an annual basis, $6.8 trillion dollars. We spend 12.4 billion on global health. So you can do the math, right? It's a fraction of a fraction that we're investing in these programs. It
Mhm.
is, I think a lot of members of Congress talk about why they invest so heavily in the military to protect their communities, to protect their states and districts. And I think if you were to apply a similar framework of protection, then I think it would merit a lot more funding just from that standpoint. And when we talk to members of Congress about, 20, 30-year timelines, the investment that we make up front to prevent disease in the future, it all makes sense. Even just from a very pure economic ROI perspective, which a lot of members of Congress are thinking about these days. And so there's many ways to show why this funding is important for all of us. I think outside of DC, absolutely, advocacy is critical. I would say district offices, it's often easier to get meetings with your representatives and their staff, especially when they're home in what are they call district work periods. So if you search the calendar for Congress, then you can find out, oh, when is my member of Congress in DC versus at home? You can talk to folks at town halls, and shout out to some of our grassroots advocates who are frequently going to town halls and talking to their members of Congress there. Um, I think other ways are writing in local newspapers. Staff still read that every day to figure out what is it that my constituents are concerned about. What are things that are top of mind for folks? And frequently, those are actually foreign affairs issues. And then the last thing I'll say is even outside of the US, I've been really um, uplifted by efforts from the global community. We have uh, colleagues with the TB fighters, for example, and who are north of the border in Canada, who just in September were talking to members of parliament about Canada's contribution to the Global Fund as the sixth largest country donor to the Global Fund, trying to get Canada to increase contributions ahead of the Global Fund's eighth replenishment cycle. So I was really amazed and pleased to see lots of PIH followers and supporters and volunteers going to Ottawa also to talk to their members of parliament about the same issues. So I think PH is a a global movement, and we have followers all around the world. People who can also talk to your members of Congress, of Parliament, about these multilateral entities, especially like the Global Fund, and different UN programs.
Mhm. Great. Thanks so much. I think we we want to leave you with positive stories. I think Vincent has shared a few. And I just want to share one or two from our field teams. Our patients living with HIV are some of our greatest advocates. They're staff members, but also people who have survived malaria, right? And we don't talk enough about malaria, but malaria money has dropped child mortality rates by 50% in Africa, probably attributed just to having modern malaria drugs. When I first started this work, 30 plus years ago, before I was even at PIH, we had one malaria medicine to treat malaria, and it was an ineffective, 100% ineffective against the most deadly forms of malaria. Um, and I just want to highlight somebody I saw recently, Dr. Bobby Farrell. He's a young boy. No, now he's a man, but he was a person that was delivered as a child by Dr. Paul Farmer. His mother was an extremis and could have died from malaria. She got treatment in Conj for malaria. She survived. Bobby survived, and now he is the clinical director of the Clinic Bon Sauveur Hospital in Haiti. So, if you save a mother and a child, you can change the world. And so, we really believe that this work is just full of hopeful stories every day. People who have survived TB. I just saw on Facebook. Wedding pictures from our dear Melquiades, who is in Bending the Arc, was dying from drug-resistant tuberculosis, and is now posting beautiful pictures of his honeymoon. So, this is about human dignity. This is about our friends, our colleagues, people who really are living good lives because of modern medicine, just the way we would want to live these lives. We would want to see our families enjoy weddings and the proud moment of seeing your son become a doctor and head of the hospital that he was born in. So, I think there are amazing stories for me as a clinician that give me hope. And I would love to hear from you, Vincent, about what gives you hope at this moment, because sometimes it is really dark.
Yeah, absolutely. Yeah, some days are just really sad, and there's been a lot of bad news this year, and it's sometimes it's just tough to carry on because it's really heavy. But I think one thing, Paul said that stuck with me is, our contributions are measured in decades, and we're fighting against historical forces that are sometimes, hundreds of years in the making. And so in that historical perspective, I think some of the changes that are happening quite quickly. And I'm amazed to see, the annual Tuberculosis Hill Day go from in 2024 having 30 people to this year over 200 people. I think that's amazing. I can't wait to see where it goes next year. March 3rd, if anybody's interested, is the Hill Day. If you're interested, definitely sign up. I think PH Engage has grown, our grassroots network has grown so much just since I started a decade ago. We had about a dozen teams. Now we're almost at 100 grassroots teams, and they're all, contact their members of Congress. They're fundraising for programs like the Maternal Center of Excellence, and that is something that
Yeah.
just gives me so much hope. Partners in Health's investment and work around these institutions of higher learning and education and clinical excellence, whether it's University of Global Health Equity in Rwanda or the Maternal Center of Excellence in Sierra Leone, is changing things in a generational way.
Mm.
I was talking to my colleague Diba in Sierra Leone, and he was saying when he graduated from med school, nobody stayed. And now I've heard from Vicky and others that we have graduating med students coming to work full time at the Maternal Center of Excellence.
Yeah.
So, I mean, it's been years of hard work and fundraising in the making, and everybody's support here from Leadership Giving. But wow, just to see how quickly that can be a game changer in the country and really have a generational impact in such a amazing, like sustained way is really cool. And that is gives me so much hope. And yeah, Partners in Health is brilliant in that it shows, what can be possible if you do put up the resources. And so and maybe not a lot of resources necessarily. So yeah, it's an honor to work with this organization because I think Partners in Health is really leading the way and showing what can be done, even in some of these dark and difficult times.
Yeah, thanks. And, I mean, lastly, to reiterate that advocacy works, right? That when we fight, we win. We win. We don't win every single battle, but we win on the whole, right? We see that the arc can bend, that we can bend it more quickly. And, difficult times need more people, better advocacy, more joy in resistance. And so I think, we get that from each other and we get that from all of you on this call because, for me, it just shows that movements are vital at times like this, and they are very, very much interdisciplinary. Whether you're good at painting and you want to make a great sign or a logo, whether you're able to, share some of what you've earned monetarily with us, whether you're a clinician, whether you're a good writer, there's so many ways to contribute to improving, the sort of standard of dignity in the world. And we're just so lucky for all of you, and you give us hope, right? I think when we think about the darkness, seeing really sad things in the field as I do, seeing really tough political things like we all are seeing, then to realize that we have this just army of people who are really willing to take some time and work on behalf of the world's most vulnerable. So you give us tons of hope. We're so grateful for all of you, and especially for the Leadership Giving Society for your constant support of Partners in Health and for hosting and allowing us to have this webinar today. And there's going to be a lot more to do. Vincent is just an increasing wealth of information. His head might explode eventually. But he's ready to put all of you to work. So we'll have lots of ways to maintain your engagement in this work. So thank you all so much.